Management of Perforated Peptic Ulcer, a review of operative and non-operative approaches. Perforated peptic ulcer represents the second most prevalent complication associated with peptic ulcer disease, and its management is categorized into surgical and non-surgical approaches. Surgical intervention encompasses the closure of the ulcer utilizing an omental patch, which can be executed through either open or laparoscopic techniques. In cases of larger ulcers, surgical resection in the form of partial gastrectomy is performed. Non-surgical treatment modalities include the administration of intravenous antibiotics, endoscopy, and stent placement, primarily reserved for patients deemed unsuitable for surgical intervention. Eradication of Helicobacter pylori is another area where intervention may enhance clinical outcomes and reduce the risk of ulcer recurrence. It is imperative that the surgical treatment of a perforated peptic ulcer is not delayed, as postponement can lead to increased mortality. This review aims to examine the role of laparoscopic surgery in the management of perforated peptic ulcers. Additionally, it will explore the significance of non-operative treatment and the eradication of Helicobacter pylori in the management of perforated peptic ulcers. Introduction. A perforated peptic ulcer is a serious condition where a hole forms in the stomach or intestine lining. It's a major complication of ulcers, often linked to common painkillers like aspirin or ibuprofen, or a stomach bacteria called H. pylori. While more common in men, it affects younger people in some regions and older populations in others. Doctors typically diagnose it using imaging scans to look for air leaking into the abdomen. Treatment has two main paths. Surgery is the most common and recommended approach. Today, surgeons often use a minimally invasive keyhole, laparoscopic technique to patch the hole, which leads to faster recovery. Open surgery is still used for more severe cases or unstable patients. For a small, select group of patients, those who see a doctor very early and whose scans show the hole is already sealed, careful non-surgical management in the hospital with antibiotics, for fluids, and close monitoring is an option. However, for most people, urgent surgery remains the standard and life-saving treatment. After the immediate crisis, treating the underlying cause is crucial. This involves testing for and eradicating H. pylori infection and reviewing the use of medications that can damage the stomach lining to prevent the ulcer from coming back. Conclusion. A perforated peptic ulcer is a hole in the stomach or intestine wall and is a serious medical emergency. Surgery is the best and most common treatment. The preferred method is minimally invasive keyhole, laparoscopic surgery to stitch and patch the hole. This approach leads to a quicker recovery. However, it requires surgical skill and equipment that may not be available everywhere. For very large holes, a more extensive stomach surgery might be needed. Non-surgical treatment with strong antibiotics is only considered for a small number of patients who are too frail for an operation. It is crucial that surgery is not delayed, as waiting increases the risk of severe complications and death. After recovery, treating the underlying cause, often a common stomach bacteria, is essential to prevent the ulcer from coming back.
This important article is authored by the following scientists:
Thank you for watching this video. Please subscribe to our channel BP International to watch more videos in the fields of science, technology and medicine.